And welcome back to the GuideWell Insights Lounge. We're here at the end of day 2 of Singularity University's Exponential Conference. My name is Kate Warnock, and I have 2 distinguished guests with us here today. We have Paul Epping and Hans Notenboom, both from Philips. Welcome, gentlemen.
Nice to be here.
Let me give your titles. Paul is the partner in healthcare transformation services with Philips, and Hans Notenboom is the global head of digital for Philips Healthcare Informatics. Gentlemen, a question for you both. Do you think that we are in the midst of a medical or healthcare renaissance?
Yeah, we certainly think so. And we see that reflected in the way medicine is transforming. We believe that the personal health space and the professional healthcare world are merging together more and more. And we actually also are pushing that into our own company. So our consumer business and our professional healthcare business, we're putting them together because we believe there is an overlap and there's a collaboration possible, and we can actually learn from each other. So that's what we're doing, and we see that across the health continuum. So as a company, we are very big in healthcare devices, in the hospital, in diagnosis and treatment. And there you already see a lot of innovations, and here we have the opportunity to show some of those innovations. So I just brought with me as an example, this is a blood testing device. It's small, it's portable, so you can take it at the point of care, and within 2 minutes you can do a blood test where you normally would have to take blood and send it to the lab. So this is changing healthcare. Another example is the miniaturization of devices. This is an ultrasound machine. Actually, this part is the ultrasound machine. This is a standard tablet, so the doctor can connect this device to any tablet that he likes, an Android tablet, and use that to do an ultrasound exam. And this makes it ultra portable, so that creates new opportunities for healthcare professionals to use these devices. So in that space, in the healthcare, call it the hospital walls, we do have a proposition, we do have products, we do have innovations, but actually it's much bigger what's going on. We go beyond the hospital walls. We also look at home care, so what happens after you are released from the hospital, and also in prevention and early diagnosis and even healthy living. We are building across that all health continuum a story and a proposition.
You know, right before our conversation started, Hans, you were talking about population health management. Clearly you guys are in this space, you're leaders in this field. Tell us a little bit more about how Philips is really going to impact population health management.
So, if you look at that whole health continuum, actually there's a lot of activities and moments in time for a consumer or a patient where information is generated. And our aim is to collect that information at all those critical moments in time, not just in the hospital where we do have our scans, our imaging, our MRI scans for instance, or patient monitoring devices, but also in the home where you have all these connected devices, even the personal health tracking devices that you might wear. And all of that information we are putting together because we believe that it's not only an opportunity for population health management, better managing the health of your population in a region, but also for you personally as a patient or as a consumer to manage your health better. And also an opportunity for better care coordination between the different caregivers.
Okay, well I think that leads me into my next question, and this one, Paul, will be for you. How will big data continue to evolve the patient care and experience?
Well, in general, you can just see around you the enormous increase of all kind of devices, small, big, and all these devices somehow produce data. Yeah? And it's not only that they are measuring or producing data at one certain moment in a day, but continuously.
Right.
So there's a kind of stream of data that is producing, and we have to do something with that. You have to have a kind of solution that is, so to speak, elastic, that grows with the amount of data that is increasing. And it's not only about the accommodation of those data, the storage of those data, but also to do something with those data. Because what else? Just sitting there in big storage rooms doesn't make any sense.
So
you have to do something with it.
Right.
And the interesting thing is that once you do analytics on these data, you again get a new stimulus to get new data, extra data. And these data in general also lead to new products, to new devices, based on the analysis that you are doing.
Right.
And in general, we see that devices are getting smaller and smaller and smaller, faster and cheaper. And once that is going on and hits the knee of the exponential curve, then it's just growing exponentially. And because of that, we will deal in the future, not now, but also in the future, with an increase of data. It's inherent on healthcare and inherent on our society. And not to forget, everybody knows that, everybody sees that, and the new oil is data.
Right.
So there we go.
Right. So obviously Philips is really poised in a great position to be able to make that data actionable. And I wanted to pivot just a little bit. You know, obviously we talk about big data and that sounds a little disconnected from the consumer. Obviously something that we want to do, and the theme that we've heard resonating throughout this conference, is really being able to scale the patient voice. How is it that Philips is going to enable scaling the patient voice throughout its enterprise?
Yeah, that's a good point that you raised there. We definitely believe that the patient should be in the center of a lot of healthcare. If I look at myself personally, if I want to have insight into my medical data, I have no way to do that. There's data of me in different hospital systems.
Right.
My general practitioner has some data, my pharmacy has some data, there's other places. And even my personal health data, if I look at the devices that people wear or the apps that you use, it all lives in silos. And that's a big hurdle for people to actually take control and manage their own health and their health data. And I think that should be a core element of the solution. That's basically enabling the person, the consumer, the patient, to give them a voice and to take control. And interestingly enough, I was at South by Southwest earlier this year.
Yeah.
And I asked people there how they feel about their personal health tracking devices. And actually a lot of people had them on, but they were not using them. No, it almost feels like we are behind the curve. Obviously the crowd, the audience at South by Southwest is a bit of a special audience,
right,
if you will.
Right.
But I think the biggest learning for me was that all these health tracking devices, the real thing behind it needs to be value. Meaningful insights that you get as a person. And obviously for a healthy person, it's even not big a driver. For somebody who's a bit, has a condition or has a chronic disease, there's a bit more of an incentive basically to start using that data.
Right.
And I think the whole point is that we find a way to put the patient in the center, give them meaning and give them control and have them manage their own data and basically take control over their own healthy living. And that's part of the solution that we want to bring to the market, and that's why we are building a platform where we not only take the data and the connectivity from all of those devices in the hospital and outside, but also allow the patient, the consumer, to take more control over their own health and their own health data.
Well, you know, I'm very involved in social media conversations, and it is such a critical conversation, I think, where people really feel like they need to own the data that's about themselves, and it's really about that patient empowerment. So I think that Philips is obviously moving in the right direction that way. It's exciting to hear that. I have one more question, and this one for Paul. Paul, if you could magically fix one specific problem with healthcare today, what would it be?
To me, it's a very simple question, but it is not simple to solve it. And Hans just mentioned it already. The data that we are producing and what I was just talking about, the increase of data, it's all in silos. And the biggest challenge that I see is how do we bring those data in a meaningful context of an individual patient or an individual consumer, because it's not only about a patient, it's also about you and me, healthy people. We are also collecting data that somehow represents our living, our health, our current being. And once you get ill, more people get involved in that. And those people are producing also data about you.
Right.
And it's not only about the ownership, it's about if I go to a physician or if I go to someone else to help me, it would be really nice that I can say, okay, here is my data. Look and tell me what you think and what I have to do.
Okay.
And that's a big challenge. So it's the context of the data,
Okay.
my context.
All right. Well, Paul, thank you so much for that answer. Gentlemen, it was so nice having both of you here visiting
Thank
us
you.
at the GuideWell Insights Lounge. I hope that you enjoy the rest of the conference, and we'll be up shortly with our next live interview. Thanks so much. We'll see you in just a moment.